I'll invite my third panel up to the stage here, where we're going to be focusing on patient perspectives on treatment. So the goal here is, as there's a whole pipeline of potential products, and hopefully even more in the future, make its way to the FDA, that FDA has an understanding of your experiences with current therapies. And when I talk about therapies, I'm not just talking about drugs or prescription drugs, but the whole range of different things that this community uses to help treat or manage the daily impacts of the condition that we talked about this morning. That could be, we've heard a lot about different medical devices such as AFOs and braces. There are certainly prescription and over-the-counter drugs that are used for many of the symptoms, as well as dietary supplements, also surgeries, different other types of therapies, and even just lifestyle modifications that might be made at home, at school, in the workplace, etc., that allow you to better navigate your day living with these conditions. And so what this session's goal is set out to do is to really give you all an opportunity to share those things that you've tried, tell us how well they've worked for you, also let us know any downsides of those therapies that you have experienced, whether that be a side effect, just the amount of time that it takes to perform a different therapy, or anything else that you might view as a downside. And then at the conclusion of our session, we're going to turn the focus towards the future. And we're going to ask all of you to weigh in on what it is, essentially short of a cure for your disease, that you would specifically look for from a future treatment. And so this is going to, essentially maybe another way to state that is, what amount of benefit would be meaningful to you on those things that are most problematic for you. And we've explored that part about what things are creating the greatest impacts, negative effects on your daily life. So we want to know what amount of benefit is it that you would like to see from that next future therapy short of a cure. To help start off our conversation around this, we of course have a wonderful panel. Our panelists are Joy, Stephanie, Kristin, and Lori. I'm going to hand it over to Joy to get us started.
Good afternoon. My name is Joy Aldrich. I'm from Seattle, Washington, and I have CMT 1A. There's nothing I can do for you. There's no treatment or cure. When I was 14 years old, this is how a neurologist diagnosed my mom, brother, and me with this hereditary neuromuscular disease that would progressively get worse as we got older. CMT is considered rare, as it's estimated to affect approximately 1 in 2,500 people in the US, but that's approximately the same as MS. So it's so frustrating that I have to explain it to every doctor I meet. Why don't more doctors know about CMT? And friends that asked, what happened to you? When I show up at events on crutches or in a boot or cast because my drop foot and weak ankles continually cause me to injure myself. I've always made excuses for not participating in physical activities, but I've never discussed my CMT, which luckily was very slowly progressing. I did eventually have to start acknowledging it and discussing it with my husband, Toby. Part of the reason we decided not to have kids was because I understood it could make my symptoms progress much more quickly, and the chance of our kids having CMT, maybe a lot worse than mine, was 50-50. After I turned 40, I struggled to walk upstairs with my weak legs and poor balance, and soon 2 stairs without a railing I couldn't even do. I started walking like a stork, hiking my knee up to get my feet to clear the ground without tripping. It was time to get some braces, or AFOs, to allow me to walk a little faster for longer distances and hopefully give me some energy return, because walking any distance like a stork became exhausting. The state of bracing for people with neuromuscular disease is quite honestly disgusting to me. While amputees now have state-of-the-art blades for running and skiing and wearing pretty shoes, we are offered a custom-molded brace that's ugly, bulky, limits mobility, and does nothing but prevent the ankle from rolling. an off-the-shelf, one-size-fits-all carbon fiber brace, which offers little individualized correction, or the $15,000 option that I was lucky enough to have my dad help me pay for, custom-molded carbon fiber Helios braces that correctly align my ankle, knee, and hip, and have some spring in them, which provides some much-needed pep in my step and energy return. I prayed these would be the answer to living a normal life. And they do help me walk and stand unaided with better balance, but they added new challenges. Finding the right shoes to accommodate the bulky brace, they didn't work well on hills or beaches, and they still make me feel disabled. It has finally been acknowledged that the phrenic nerve, which conducts signals for breathing to the diaphragm, can also be affected, and not just in rare types. Diana, Lainey, and I have lost our moms to CMT-related respiratory failure. I'd do almost anything for a treatment to help me regain the strength in my diaphragm muscle. I'm terrified of the flu and pneumonia, and I'd love to be able to lay flat for a massage or in a dentist chair without having to sit up every 10 minutes to catch my breath. I'm sick and tired of being hassled by TSA over my leg braces and BiPAP when I travel. Wouldn't it be awesome to ditch them both? Recently, I helped HNF draft a letter to CMT patients announcing hope is on the horizon. Farnext PXT 3003 clinical trial is proving the combination can regulate the production of the extra protein my body is producing so that the damage can be halted, and I may even be able to regain some function. If my 12 and 14-year-old nieces have CMT and the pediatric trial is started soon, their progression could be halted by age 15. Grace can continue playing volleyball, and Anna can keep running, as she puts it, like a wolf through the moonlit woods at night. She's definitely got a flair for drama. It seems too good to be true. For nearly 35 years now, I've been told there's nothing I can do for you. Now, I optimistically await the news of when this drug will be available to me, my brother, and my nieces. I'm excited about PXT 3003, but my mind is whirling with questions too. Will I be able to access it via compassionate use or right to try? Will I be able to afford it if I have to take it every day for the rest of my life? Will I still have to spend hours looking for shoes that accommodate my leg braces and walk with a cane, or worse, a wheelchair? Will I be able to walk side by side on the beach in Maui and hike at Mount Rainier side by side with my husband again? What I'd give just to be able to go for a walk with my 2 Labrador retrievers. In just 30 short years, I watched my mom go from very active to limited mobility to a wheelchair to death by respiratory failure secondary to CMT when she was only 70 years old. I'm haunted by the shadow her life is casting over mine, but I'm starting to get really excited about the hope on the horizon.
Hello, my name is Stephanie Carmody. I'm 40 years old, and I have a rare and severe form of hereditary neuropathy called TRPV4-related hereditary neuropathy, also known as Charcot-Marie-Tooth type 2C, and scapuloperoneal spinal muscular atrophy. Having this disorder has not stopped me from pursuing the higher education, having a career, and getting married, but it has made a huge impact on how I live and experience life, and it necessitates endless adaptation. To start, I was born with foot deformities, torticollis, and hip dysplasia. As a result, I had corrective foot surgeries in infancy, but was still never able to stand or walk on my own due to severe leg weakness. At 18 months, I received my first walker, a pair of caregivers, or long leg braces, but with a strong upper body, was able to walk. Later in childhood, I developed severe scoliosis and had a partial spinal fusion at 8 years old, to prevent further curvature, restrictive lung disease, and digestive problems. My braces, walker, crutches, and spinal fusion allowed me to attend school, play with friends, and be active with my family. I've also always had vocal cord weakness with stridor. I needed a tracheostomy during my spinal fusion for airway access. I practiced vocal exercises to optimize my weak voice, but it remains high, quiet, and breathy, which makes it difficult for others to understand me, especially in loud settings. Starting around age 10, I developed significant hand weakness, which manifested in the typical claw hand pattern of hereditary neuropathy. In early adulthood, I developed significant respiratory insufficiency with severe sleep apnea and have been dependent on a BiPAP with supplemental oxygen at night ever since. My BiPAP breathes for me, but I stop breathing during sleep due to diaphragm paralysis. It reduces the burden on my weak respiratory system, allowing rest, and completely saved my life. I would not be here with you today without having had it. I stopped walking altogether at age 25 due to respiratory insufficiency, fatigue, and increased hand weakness and pain from using crutches. I've exclusively used my wheelchair since. Although using a wheelchair comes with many accessibility limitations, it has given me the freedom to move more quickly and efficiently and reduce my hand pain and fatigue. I recently received my first pair of hearing aids because my disorder has caused hearing loss. I am mostly independent with activities of daily living, but have to use assistive devices and adapt most of them. Yet they take significantly longer for me to perform than the average person. I use an adjustable bed at night, shower bench, and handheld shower head since I can't stand in the shower. I'm limited in how I style my hair since I can no longer hold my arms above my head. I avoid clothing with buttons and zippers due to hand weakness, and am limited in the types of shoes I can wear because of my foot deformities and foot fusions. I had to invest in renovating my kitchen and closets to lower counters, and install pull-down rods and shelves for access. While I love to cook, I struggle to hold knives and utensils, and opening packages is very difficult. Grocery shopping, cleaning the house, and doing laundry is so difficult that I've had to hire help. I use a manual wheelchair with a smart drive push assist to get around. Drive a wheelchair ramp van with a lowered floor kneel system, driver side transfer seat, and hand controls. But of all my symptoms, the respiratory weakness and the severe fatigue that goes along with it make the most impact on my daily life. I have to sleep more than the average person. I often have to leave work and important family and social gatherings early, or miss them altogether due to extreme fatigue, and I'm not able to fly or travel as much as I want with my husband. Because of the respiratory insufficiency, the vocal cord paralysis that goes along with my rare form, it can be life-threatening. Unfortunately, for me and others with my disorder, there's currently no treatment available other than supportive therapies. There are children with my disorder who have never been able to walk, who need permanent tracheostomies to be able to breathe, yet who are dependent on a ventilator. We are in desperate need of accelerated research into basic science to understand the exact mechanism of our disorder, get into functional treatments that can improve the quality and length of our lives. I am in need of treatments to extend my life expectancy, to keep me off of a ventilator full-time in the future, to reduce fatigue so I can work more hours, spend more time doing advocacy work, participate, get social activities, get family gatherings, get to strengthen my muscles to make ADLs easier. I need treatments that will improve my respiratory function so I do not get fear during cold, get flu season because of my higher risk of airway obstruction and respiratory failure. I thank you so much for this opportunity.
Good afternoon. I'm Kristin Gelzinis, mother of Parker and living with CMT4C. CMT4C is one of the more rarer types, so it affects everyone differently. For me, it's impacted my balance, my coordination, my muscles have atrophied, my vocal cords are affected, and my diaphragm no longer works. It's hard for me to walk without the use of leg braces and crutches. They help me maintain my balance and prevent falls. With them, I am able to enjoy life with my son. We are able to explore the zoos and parks. We can enjoy the beaches and family outings. They allow me to continue walking when my doctor suggested using a wheelchair. Unfortunately, leg braces are not without their own burden. They are big and clunky. They are heavy and awkward. They are expensive even with insurance coverage. It makes buying nice shoes nearly impossible, and they aren't the most comfortable to wear. They also do not guarantee that you won't fall. My crutches help me maintain my balance, especially on uneven ground. But they put a lot of strain on my hands and wrists. And with a disease that causes arm and hand weakness, this is eventually going to be a problem. I won't be able to rely on them for much longer. With vocal cord dysfunction and diaphragm paralysis, I need to be extra cautious around those who are sick. If I catch even a simple cold, it sends me into respiratory failure and admitted into the hospital. I've been in the hospital 3 times this past year, each time being a little more serious and requiring a little more intervention. The very last time I spent a week in the ICU and on a ventilator, something I really never want to experience again. Nor do I want my son to ever have to see me like that again. I depend on a BiPAP at night. It gives my lungs a break from working so hard. So far, it's kept me out of the hospital and breathing a bit easier. Unfortunately, because diaphragm paralysis is not something widely known about, there's been no standard of care developed for those affected. There's no standard treatment. After my doctor found out I had diaphragm issues, it took over a year for me to obtain a BiPAP and 2 more hospitalizations. Without that standard of care, treatment for diaphragm paralysis is anyone's best guess, and that's really scary when it's your health on the line. When I was first diagnosed, so many things ran through my mind. I was relieved to know what I was up against, but I was scared learning Charcot-Marie-Tooth disease was progressive. I was a semester away from completing my nursing degree. I was an active EMT that had volunteered on the weekends, and now I had this little boy who relied on me. My house wasn't set up for someone with a disability. We had carpets that made it hard to navigate, steps that I couldn't get up, and now baby clothes and toys that were not user-friendly. I couldn't snap those little onesies. We had to make sure we got pants and shirts without those buttons. Baby swings, kid toys, and equipment made my house a minefield, impossible to navigate without falling. The stroller became my new best friend. I had progressed so much during pregnancy, I was relying heavily on my wheelchair. When Parker was born, using a wheelchair no longer seemed like a good option while I could still walk. I wanted to enjoy my time with him. I started taking him for short walks, further and further each time, until I regained some of the strength I had lost. As time passed, I walked with crutches more and more and used my chair less and less. I continued to do the exercises that I know will help. I try to eat more balanced and continue to remain as active as possible. I follow up with my neurologist to help me manage my pain with the use of daily medication. Without it, I wouldn't be able to get out of bed or live a normal life. Without the medication, I'm bedbound and unable to move. Taking Parker on walks to the zoo and parks would no longer be possible. Enjoying my life with him would be over. Now, with the new restrictions and mandates that are continually placed on pain medications, I fear the day my neurologist says he will no longer be allowed to prescribe it. I know I would be forced to use my wheelchair more and lose the ability to enjoy my life with my son. If I become bedridden, that terrifies me. Living with this disease causes a tremendous amount of frustration. No matter how hard I try to get stronger and keep my body in good physical shape, I will always have CMT as an underlying issue. It rips out everything that I've worked for. After my last stay in the ICU for respiratory failure, I'm coming back even weaker and more uncertain of my future. For the first time in a very long time, I am scared. I can't help but worry about my future. I wonder if it will be cut short. Am I receiving the right treatment? I don't want to leave my son behind. I hate having him watch me when I get sick. I see the fear in his eyes. Am I giving him the life he deserves? The life I had always envisioned for him. I wanted so much more for him and me. All of the things that I had taken for granted are now at the forefront of my thoughts when I lay down at night. I won't allow that fear to rule my life. We need a treatment that will halt progression of Charcot-Marie-Tooth disease. We need people to take it seriously and understand how disabling and life-altering it truly is. We need people to find medications that'll help all of us.
Hello, I'm Lori Sames from upstate New York. In March of 2008, my husband and I were told that Hannah, our youngest of 3 daughters, had giant axonal neuropathy, or GAN. GAN is one of the most severe forms of inherited neuropathy and impacts every nerve cell in the body. We were told Hannah would continue to weaken. She would lose the ability to walk, speak, swallow, and it would eventually succumb to pneumonia in the 2nd or 3rd decade of her life. GAN is ultra rare with about 75 known cases worldwide. At the time of Hannah's diagnosis, there was 1 investigator in the world studying GAN. There were no treatments, no best practices, and no translational research underway. After picking ourselves off the ground, we decided to fight. On July 21st, 2016, Hannah received the first in human intrathecal gene transfer, funded grassroots by an army of supporters. That is the trial that Dr. Thomas referenced at the beginning of our afternoon session. I must tell you that the single most stressful day of my life was awaiting the results of Hannah's pulmonary function test. She needed a score of at least 50% to satisfy inclusion criteria for the gene therapy clinical trial to the central nervous system. The second most stressful day of my life should have been the day Hannah received that injection with the AAV9 viral vector. Hannah is a homozygous deletion, meaning she makes no endogenous protein. The 4 patients before Hannah were missense mutation patients. So while the protein didn't work, the immune system knew it was there. If the immunosuppression protocol failed and Hannah launched a T-cell response to the transgene, it would have very likely been fatal. We knew what we were signing up for. Instead of intense fear, on the morning of Hannah's injection, we felt relief and optimism about Hannah's future for the first time in nearly a decade. The only definite thing was GAN was killing Hannah. The injection was her only chance at having any quality of life. Her tomorrow looked grim. She was fragile. She weighed 58 pounds. She would go to the nurse's office at school, sometimes twice a day, to nap. She would rarely make it to the restroom in time, both at home and at the long hallways at school. She couldn't feed herself. If she was finally able to get food on a utensil, it would fall off while en route to her mouth. She would cry in frustration. She was having difficulty grabbing things and navigating her iPhone. Her vision was worsening. She would experience bouts of vertigo several times a day without even changing positions. One pinky developed a contracture. Her stridor was worsening. Drool began running out of her mouth, and food began falling out of her mouth when she ate. She developed sleep apnea. Her legs would buckle when standing while supported. We knew from other GAN patients how rapidly Hannah would decline if she were to lose the ability to be weight-bearing. With certainty, if Hannah hadn't received this injection 26 months ago, a common cold this coming winter could take her life. The natural history of GAN reveals a dramatic change in these children in just a 6-month period. While I'm not privy to the data from this current AAV trial, I can say with certainty that Hannah is much stronger in all proximal muscle groups. Her balance, proprioception, and fine motor skills are dramatically better. She can feed herself without frustration. She can grab a bottled water, bring it to her lips, and take a sip without spilling. Episodes of vertigo are greatly reduced and now only occur if we lay her down too quickly, like to get in bed at night. Her stamina is greatly improved. No more naps in the nurse's office during her school day. Her vision is stable out 24 months. Muscle control of her eyes is much better, and we definitely noticed this in photos, pre and post gene therapy. The comparison is really staggering. Her pulmonary function is stable out 24 months, and urinary urgency is better than baseline. She's thriving and now weighs 81 pounds. I'm eager to see if Hannah's leg strength will show any improvement at her next visit. We feel incredibly blessed. From a quality of life standpoint for Hannah, my husband and I, Matt, and Hannah's caregivers, I feel continence of bladder and bowel and the ability to stand to transition to the toilet are critical. Because of this, we can still travel freely with Hannah and spend hours at a theme park without having to figure out where to lay down an 81-pound child to change a soiled diaper. We can fly cross country. She can use the bathroom at school like her peers. However, we've noticed Hannah has been having choking episodes while eating. If she doesn't swallow twice per mouthful, food that's drenched in saliva on the back of her tongue will slide down her throat as she's focused on the new mouthful of food. Her speech is now high-pitched at times, and it's really been striking to me today. I knew it wasn't vocal pleuresis because if I asked her to speak really loudly in a low voice, she can. It's her diaphragm that's being impacted. When Hannah came down with the flu last winter, as we all know all too well, the flu vaccine didn't have coverage last winter, her body temperature dropped to 94.9. These are indicators that we must move quickly to get a trial underway targeting the autonomic nervous system. Preliminary studies in Dr. Stephen Gray and Rachel Bailey's labs, they're now both at UT Southwestern, indicate we can use the same vector construct as the current IND, even in rats pre-immunized weeks prior by intrathecal route with the same vector. This is amazing. That's a win we didn't anticipate. From a neuroanatomy standpoint, neuropathologist Diane Armeo confirmed the areas we see pathology in our GAN knockout rat are the same areas responsible for the human autonomic phenotype we're seeing in GAN patients. If we're able to launch an autonomic gene transfer IND for the treatment of GAN, we expect this intervention to help with body temperature control, sleep apnea, swallowing, weak speech, likely from a weak diaphragm, constipation, bladder control, respiration, and abnormal heart rate, which appears late in the disease process. I hope we are before you, FDA CBER, for a pre-IND meeting in January. Like ALS, any intervention for GAN that halts or even slows disease progression is a huge win. Every week that slips by for a patient with GAN or CMT4J or 2E or 2C or 4C or CMT2A or CMT6 and many others results in severe functional loss and puts patients at risk. Today we've had a repeated theme: be a voice, speak out. And I'm going to take this moment to speak out to Oprah Winfrey, Bill Gates, Warren Buffett, Sarah Blakely, and whoever else has the financial means to help the Hereditary Neuropathy Foundation start checking off these diseases one by one. The inherited neuropathy community is, I believe, the most underserved community on the globe. In this small conference room, small ballroom, there are people from 4 different countries. This is a different aspect of global health. The technology is there to treat these diseases. What's missing is the attention and funding. Please reach out to the Hereditary Neuropathy Foundation. Precious and innocent lives depend on us all. Thank you.
So thank you to this panel for not only talking about their experiences with these conditions, but really thinking critically about the things that they've tried, both good and bad, and sharing those experiences. So join me in thanking this panel. So now we go to our 4th and final set of polling questions for the day on this topic of patient perspectives on treatment. So pull out your phones, your iPads, your laptops. We've got a number of questions, and these are open to patients and caregivers of patients across all age ranges, both pediatric and adult. So we can go to our first polling question for session 3. So our first question is, when considering treatment options, which of the following benefits would you consider to be most meaningful? And you can select up to 3 options. The response options are A, ability to balance and stand, B, ability to walk unaided and reduce falls, C, improved hand function such as grip strength, fine motor skills, D, increased energy, E, orthopedic improvement such as deformity correction of feet, hands, back, or hips, F, improved respiratory, vocal, and swallowing issues, G, improved senses such as vision and hearing, H, reduced pain, or I, some other benefit that you would consider to be most meaningful when considering a treatment option. And based off the number of responses we started with, I have a guess a lot of you had a head start. So I'll give you just a few more moments to get this your up to your top 3 benefits that you would consider to be most meaningful when considering treatment options. As it stands, the benefit that has been most selected is the ability to walk unaided and reduce falls, followed by the ability to balance and stand. Not far behind that is number 3 is improved hand function. There's a number of the other options that have been selected by some number of you, increased energy, reduced pain being among some of the higher. But there's at least a few of you that have selected other things. And again, as part of our audience discussion, I hope you'll please share what other benefits you would view as being most meaningful. We can go to our next question. So this question is, have you ever used any of the following medications or therapies to help reduce symptoms of your CMT or inherited neuropathy. And here we want you to choose all that apply. So your options are A, prescription medications for pain, B, prescription medications that are muscle relaxants, C, prescription medications that are antidepressants or anti-anxiety medicines, D, psychotherapy or behavioral therapy, such as counseling or support groups, E, physical and occupational therapy, F, diet modifications, G, bracing or adaptive devices, such as AFOs, as well as mobility devices, such as crutches and scooters, H, complementary therapies, such as acupuncture, meditation, massage, and exercise falls into that category. I, some other medication or therapy that is not listed, or J, if you use none of these medications or any medication, really. So please choose all of the following that you use to help reduce the symptoms of CMT or your inherited neuropathy. All right, give you just a few more moments. Right now, it looks like the two that seem to rise to the top as being the most utilized are the bracing, adaptive, and mobility devices, followed by physical and occupational therapy. After that is complementary therapies, everything from acupuncture, meditation, massage, and exercise. You see the approaches being experienced with each of the four different prescription medication categories, as well as with diet modifications. There's some experience with other medicines, and there might be a very small number of people that are not using any medication or therapy. We can move to our third question. So which would you rank as the most important to your decision about whether to use a medication to help manage your CMT or inherited neuropathy symptoms? Please choose two. So your options, these different factors for your decision making are A, how the medication is administered, such as if it's by injection, oral, or intravenous. B, the frequency and length of treatment. C, your access to treatment, such as insurance coverage. D, whether the medication was studied in adults and or children. E, how much the medication showed benefit for a specific symptom. F, common side effects, such as constipation, dizziness, dry mouth, or headache. G, rare but serious side effects, such as blood clots, severe high blood pressure, and hair loss. H, your previous experience with a similar treatment. Or I, whether other treatment options are available. So please choose the top two of these factors that you would rank as most important to your decision about whether to use a medication to help manage your disease. Okay. So while the final results are still coming in, I think it's fair to say that how much the medication showed benefit for a specific symptom was the factor ranked as most important by the most of you, followed by your ability to actually access the treatment, such as having insurance coverage for it. So there are a number of you that selected each of the other categories, perhaps rare but serious side effects being the third most important factor amongst the participants today, and your previous experience with a similar treatment perhaps being the least important factor of those, rating at least your top two factors with us today. So can we move to the fourth question? So this is a question about clinical trial participation and what would perhaps discourage you from participating in a clinical trial. So the question is, which of the following measurements would discourage you from participating in a trial? And please choose all that apply. So A, being able to walk unaided for a specified distance as quickly as possible. B, a pinprick test. C, a vibration test. D, electrodiagnostic testing. E, measuring foot and hand muscle strength. F, giving blood or tissue samples. G, MRI testing. H, a nerve biopsy. I, pulmonary function testing. Or J, none of these measurements would discourage you from participating in a trial. Please choose all that apply. Give you just a few more moments to get in your responses. We're selecting all of the different measurements that would discourage you, if any, from participating in a clinical trial. It appears that the greatest response is that from you is that no measures would discourage you from participating in a clinical trial. For those of you that did select measurements that would discourage you, those that were the most discouraging would be the nerve biopsy, followed very closely behind walking unaided for a specified distance as quickly as possible, and electrodiagnostic testing. Although there was at least some response for each of the different categories, none had no responses. Can we move to our fifth question? So this question is, if you were to participate in a 6-month clinical study, what would you be willing to do as part of the study? And select all that apply. So would you be willing to fill out a daily electronic diary or questionnaire? Would you be willing to wear one or more devices to monitor activity, such as an ankle sensor or an armband? Would you be willing to maintain a specified diet and or exercise regimen? Would you be willing to submit a videotape on a regular basis, such as weekly or monthly? Would you be willing to answer a brief questionnaire by calling a toll-free number? Or would you not be willing to do any of these things at home, or do anything at your own home? So which of the following would you, again, be willing to do at home as part of the study, a 6-month clinical trial? Okay. While everyone's final results are coming in, it looks pretty conclusive that most of you would be willing to do all of these different things at home, and only a small minority would not be willing to do any of these at home. Perhaps very slightly, the ones that you'd be most willing are to wear a monitor for activity, and to answer brief questionnaires by calling a toll-free number, but they're all fairly close there. We can move to our 6th question. So this is, what types of procedures or activities would you be willing to undertake in a clinical study? Please select all that apply. Provide blood samples. B, provide tissue samples such as skin, nerve, and muscle biopsies. C, lying inside of an imaging machine for long periods of time, such as an MRI. D, receiving injections into the muscle on a periodic basis of an investigational or experimental drug therapy, such as in your diaphragm, peroneal, and hand. And then E, you would not do any of these procedures, or F, if there are other procedures and activities that aren't listed that you would be willing to undertake. So while final responses are trickling in, looks like the thing that you'd be most willing to undertake while in a clinical study is having your providing blood samples. although there's seems relatively high response rates to each of the other activities that were provided. Some of you have identified other things that you would be willing to undertake, and some very small minority, it looks like, would not be willing to undertake any of these activities or procedures. Now we'll go back to the audience discussion. As an audience here in the room, those on the web, we have our webcast moderator, and what we want to do is build on this panel discussion that we just had, which focused on these discussion questions of really initially assessing current treatment options and approaches that you have. As I mentioned when I introduced the panel, this is not only drug treatments that you might have, but medical devices, whether that be braces or mobility assistance devices, dietary supplements, even things like diet, exercise, and as Stephanie so nicely said, endless adaptation. We want to hear about all of that. We heard one exciting approach to that with the hooks or the loops earlier. And so to start, I want to we'll go back to starting broad, because there's a lot of things that may have worked really well for you. There are also things that you may have tried that just did not work well for you. And whichever of those experiences you feel is very valuable and important to share, I want to give you that opportunity. Of course, we have some issues we'd like to explore, and we'll get to those. So who would like to start by sharing a treatment experience, either something that's worked well or maybe not so well? We have a hand here. Yep.
I could just first say...
Use the mic, please.
Just first, I just want to... my name is Dr. Glenn Pfeffer. I'm an orthopedic academic foot and ankle surgeon at Cedars-Sinai. I'm co-director of the CMT program there. I think we've probably operated on more CMT feet than anyone else in the United States. I want to thank the patients, coming from a doctor's point of view. Your bravery is an example for all of us. I want to particularly thank the HNF. You've done a stunning job here at bringing together all the elements of the CMT community. The FDA, too, and their commitment to this is exemplary. I've been on many FDA panels. You guys are very busy, and please keep up your commitment to CMT patients. The comment I wanted to make that fits in is that Dr. Thomas noted that there's not really been any good studies on CMT surgery, and he's absolutely correct. But today, thanks to a grant from the HNF, we are starting the largest prospective multi-center study on CMT surgery that's ever been conducted. It's being done in conjunction with the American Orthopedic Foot and Ankle Society and their M2S data platform. That will change the world, those results, in the years to come. And not less importantly, with the help of the CMTA, the Charcot-Marie-Tooth Association, we're meeting this weekend with a think tank in Chicago to hammer out the guidelines for both patients and surgeons on CMT surgery. So a good week overall, I think, for CMT. Thank you for letting me make those comments.
Yep. Just to pick up where we left off, we're starting broad. We're exploring experiences with treatments, which again is broadly defined, not as just medicines, but anything you might do in your daily life, whether it be something over the counter, dietary supplements, pretty much anything that was listed on those slides as different things you might do, including exercise, and whether that be something that's been helpful or maybe something that didn't work so well. We'd like to hear your experience. So we'll start with you.
I'll be the first guy in the room to mention medical marijuana.
Mm-hmm. We had it on the slide. We had it
okay. I'll say it then.
Yes.
I had hip surgery when I was 16. Was in a body cast similar to some of the photos that I saw earlier. And for quite a long time after the surgery, I was kind of in denial. I have CMT 1A with my sister. And I kind of pretended in my mind that my sister was the one that had it and I didn't, and that my mom had it and I didn't. So I tried mountain biking, I tried all kinds of things, extreme sports, everything I could try and find to kind of prove to myself. I started working professionally and sit for a long time, gained a lot of weight, and started being prescribed pain medicine for my hip. They told me to wait as long as I could for a hip replacement. And so the pain medicine, like all pain medicines right now, just kind of, you end up getting more and more prescribed. You get on heavier and heavier stuff. And then the press comes out and starts talking about all these pain medicines, and then your family starts worrying about you and things like that. So fortunately, I was in Seattle at the time, and medical marijuana started to become a lot more accepted. So I started on that and was able to reduce the amount of fentanyl that I was taking by every other day by 60%. And I'm on the same amount of pain medicine for the last 7 years using marijuana. I live in Chicago now, and so I don't want to spend time in the Cook County Jail with everybody else. So it's kind of something that I have to sneak around. But I continue to do it because I'm not interested in increasing my pain medicine at all. And at some point, I would love to be off of it completely. So I'm really glad that the FDA is here, and I'm glad that we have all these incredibly strong people, not only in the audience, but on the panel. So I wanted to thank everybody on the panel and H&F and all the brave people of all ages, especially the first panel, because it brought back a lot of memories for me of how I felt. One thing I wanted to say earlier about the bullying is that all kids are going to find something different to point out so it doesn't show what's different about themselves. So all these kids that, I shouldn't say young adults, sorry, that have shared their stories and shared their fight, just realize that those are the kids that won't make it as far as you will in life, because you have that heart and you know what a fight is and you know what the differences are, and you're going to learn to love and respect those things. And as far as online dating, I can tell you right now, if the guy is still here, there he is, there's hope, because I found somebody. And I spent 4 years after my divorce thinking, that's it, no more, never going to do it again, I'll be single the rest of my life. But when you do find that person that loves you for who you are and on the inside, they're going to be with you all the time. And so, you know, the commitments that I've heard from, you know, caregivers and significant others, there's somebody out there for everybody. I truly believe that. And they're going to love you for who you are on the inside and the fight that you've continued on through your life. So everybody has challenges. You could get in a car accident tomorrow and have just the same issue, and that person will still love you for who you are if you were at the right person. So I would encourage everybody to find these people that love you. Like my sister and I have really relied on each other since we sat there and watched our mom pass away. It does create that guilt. I've got 2 daughters, and my ex doesn't want to have them tested because she doesn't feel that if they get tested and that it's positive, that there's nothing you can do anyway. There's no cure, so why tell them? I think a lot of us have learned early on. I was in 2nd grade when I learned I had CMT. It didn't affect me. I was in denial for a long time, but I still knew in the back of my mind that it was something I had to think about later in life. So all of these people here today have given me strength to accept that I have it. And all the fighting that everybody has done on all these different levels and sharing these ideas, this is what is going to make all of us find the cure, all of us together. So the results say it. Everybody's willing to do just about anything in these trials to find a cure for the people they love, and they love themselves. So I hope everybody's on the same page on this at the end and that everybody agrees. So thank you.
Well, thank you, John. So have a quick follow-up question for you, if you don't mind. I know you covered a lot of ground there, so thank you for sharing all of that. But I do want to know if, when you moved to Chicago, if that created any, let's call them, interruptions in your ability to use medical marijuana. And if so, did you notice any changes in your pain, your ability to manage pain with the amount of fentanyl that you're on? And just in general, how would you categorize your level of pain management, even with the therapies you have?
Well, they use the 1 to 10 scale for your pain, right? So I think pretty consistently I've told doctors 7 or 8 on the amount of pain, but the medical marijuana not only relieves the pain, but it also kind of changes your mindset. It comforts you, it relieves the anxiety. There's different methods, obviously, of either ingesting it through an edible or smoking or vaping or all these other things that they're coming up with. But it's kind of like when first cell phones came out. You'd get a new one every 6 months or even 2 months. It's the same thing with the technology with medical marijuana. It seems like there's more and more research being done and more methods for it. So the respiratory thing is something of a concern with smoking it. But I've found that edibles are actually makes a bigger impact on the pain and less impact on my mind.
Sure.
So as I mentioned, I haven't increased the amount of prescription medicine for 7 years. So some of it has been just not wanting to increase because I fought so hard to decrease. The pain is also a mindset. If you become a hostage to it, it's something that you can just stay home and make an excuse.
Sure.
So as far as the amount of medical marijuana I take, it varies just based on the pain. It's not something that I'm a slave to like I am with my prescription.
Okay.
Going from Seattle to Chicago was very difficult. It's like that with every time I have to get a doctor. They put you through the same process of making you feel like you're a drug addict, a drug seeker, and you have to wait till the second or third appointment. You got to do blood tests. You got to do all this proof that you are who you say you are and that you're not trying to just score. So I think that that's really important with all the press about fentanyl and whatever's next that they're going to complain about. There's a significant amount of people in Chicago specifically that were prescribed things in a car accident or something else, and then the doctor just cuts them off, and then they're forced to go out and find street drugs or something else that'll work. So I think it's a really dangerous time with the amount of press on opiate addiction. It's a real issue. Doctors overprescribed for a very long time, and now they're kind of trying to cut back. And it puts people that are in pain, specifically with CMT, the doctors will know, oh yeah, I've heard of that, I know what that's all about, and they'll either write a prescription or say, there's no pain associated with it, you're not in pain.
Sure.
So hopefully with all this advanced research and everybody willing to do all these different tests that are scary, but you know, I think that medical marijuana is a good bridge to get us to where we're going to go with the cure. It's not something that's going to fix it, but it is something that makes me comfortable, and maybe somebody similar to me that's going to feel the same way.
Thank you, John. So we have a comment here, and then a comment here, and then I'll step back so I can see more of my periphery.
I would just like to say that, you know, we also live in a state where medical marijuana is not legal. However, we do know as a family that is one of the best methods to treatment for the pain. And I totally understand what you're saying as far as being a slave to the prescription medications. And I just want to encourage whoever's in the audience or whoever's on the FDA who doesn't believe that marijuana is an answer to a lot of this pain, you really need to look at things a little bit closer, because the news skews the way people view things, and the views are very skewed on opiates right now. We are not in an opiate crisis, we're in a heroin crisis. And when people don't get their heroin, they turn to opiates, and that's where the addictions and deaths come from. So let's focus on what the real problem is, which is heroin versus pain medications.
I just want to say my mother's 63 years old in a chair herself, and 4 years ago she started using pain medicine. Not quite sure how she made it her entire life. I battled my doctor for 2.5, almost 3 years, him wanting me to go on pain meds, and I did not want to go on pain meds. No one, I live in the state of New Jersey, and you know, people used to be able to get you could get refill, 3-month supply, everything. Everything is so calculated. You can get your medication like a day before if it's a narcotic like that. It's so restricted that you cannot abuse it, because if you do, you have no medicine then. And nobody's looking at that side of it. What about the people who have, especially rare diseases, people who require the medicine and have to trek out in snowstorms and things like that because you have to go to the doctor 12 times a year to receive your medicine? And it's really frustrating. It is a lot on the news and the epidemic and teenagers hitting cabinets and things like that. But it is, the heroin's the cheap thing. And, and probably another, it was ecstasy for a while, and drugs go through these things. Ketamine was a big thing. Now they're using ketamine for treatment and after surgery in the OR. So no one ever thought that was gonna happen. But I also, too, you brought up about testing. I met someone approximately 2 years ago who had CMT and again did not want their children to be tested. And it took me over 10 years to get a diagnosis. I was begging the NIH to come down. No one could figure it out. And it's a real frustrating thing. Sure. And when you go through that, and then to find out that, well, someone has it and you can get your child tested, or a family member test it, it's really frustrating. Do you want, what if your child ends up with certain symptoms that maybe you didn't have, and what if something happens to you? You want your child to go down that route of struggling for a diagnosis? The technology's there. It's cheap enough now to get genetic testing done and stuff. There's no reason, there's no exception to not get tested.
Sure.
And other thing was the marijuana. The respiratory, do you find with the smoking, because a lot of us have with the respiratory, edibles are most likely like the better route to go? Because that's what scared me was, I want to consult with the medical marijuana doctors we have now and dispensaries, because I'm hearing more and more it really does work.
I think that's valuable
our
concern
edibles,
to raise. Yeah. Okay.
Are edibles a thing?
If anybody is going to try it, I would definitely recommend the edible route first and give yourself ample amount of time before you try something again, because sometimes when you eat it, it takes an hour, hour and a half to kick in and feel it. So it's something that you need to slowly get into under doctor's supervision, and they'll tell you all the different information that you need to know. But going the medical route is definitely the best way to go, because unfortunately, when in Chicago, you're getting it different places, different whatever. So I actually still go to Seattle and risk my trip back because it's still something that's very new. So I would I want to caution everybody what I said originally. Be very careful with getting into it, because it is something that is regulated. It is something that still can be abused, and so I would definitely recommend the medical route. And it's slowly coming across the country. If you live in the South, I'm sorry, it's going to be a while, but Illinois now has medical. It's very difficult to get a medical card there, but I definitely recommend under a doctor's supervision.
Great. Thank you, guys. All right. I think Estella, did you want to say anything?
We have one question over here.
Okay.
Hi, my name is Estella Lugo. Since we're on the topic of medical marijuana, I just recently kind of came out of the whole, being hesitant to talk about it. I think the stigma is finally being lifted, especially in the medical community, and it is being finally recognized as a valuable treatment for pain. And as a mother, you're always a little hesitant to talk about these things publicly because you don't want to be judged. But I'm finally at the point in my life where I do feel comfortable about speaking up about it. And I know a lot of people can relate that they do whatever they can to avoid prescription pills and things that can have harmful side effects, especially when there's not much research out there to contradict that. And for me, myself, I'm lucky enough not to experience the horrific pain that some of you have described today, but I do suffer from fatigue, which I know is also a very common symptom. And there are days when, especially as a mother with younger children, that you are exhausted, working full time and taking care of your family and your home. There are days where 3 or 4 o'clock rolls around and I just want to collapse into my bed. And the only thing that prevents that is the use of medical marijuana. And it alleviates any anxiety that I have, as well as my muscle fatigue. And from that point forward, I am able to complete my day successfully as a high-functioning adult. And I'm also able to exercise. And I think that really makes a difference to whether you have the ability and the energy to exercise on a regular basis and not. Because for me, exercise is vital to my health. And if I go a few days, a few weeks even, I feel a difference. And without that, my falls become more frequent. And if my falls become more frequent, I am at risk for injury. And if I am at risk for injury, that means broken bones, that means surgery, which can then spiral into a wheelchair. There might be a day where I am not able to get up from a fall, and that's what keeps me going. So the use of medical marijuana for me is incredibly important, and I urge all of you to, if you do have some hesitation, to do some more research and to really, look into it.
So
thank you.
Something you said was interesting to me was that it also allows you to exercise, and the exercise is really important to help you not fall. Can you talk about your exercise regimen and how you've seen that, if there's ever been changes, and maybe how that's resulted in more or less falls?
Right, so if I'm able to, have the additional energy, I'm able to get on a treadmill, which can improve my cardiac, my cardiovascular health. It also, I believe, fundamentally, that movement is medicine, and that you're able to keep your body moving, you are slowing the progression. And if you're able to add some kind of resistance training, some kind of weight to your exercise program, even if it's not significant, if it's more than your body weight or your body weight alone, it makes a difference to slowing the progression and sometimes even reversing it.
Great. Thank you, Estella.
Thank you.
So we had a comment in the corner.
Hello.
Okay.
Hi, my name is Kara, and I'm a caregiver. And I guess it's also along the medical cannabis topic. But my family lives in Chicago, so I've recently gone through the process, and it is an onerous application process, and we ran into some complications with a neurologist that didn't agree that CMT was in the muscular dystrophy family or wouldn't even approve it. But the governor also recently signed a bill to, help reduce the kind of the process you have to go through if you have an opioid prescription. So that's something that has helped. My mom has also tried all kinds of pain medications. Some of the other options on here as well, like weekly massages, acupuncture, which she actually found acupuncture helped a little bit. So one of her concerns with medical cannabis was, my mom's never done anything illegal in her life. So like she was just really afraid to try it. She said she doesn't want to, feel high. And so I think that, to Estella's point, like educating ourselves on it, and that, she's been able to use just this pure CBD oil, which, when we eased into it because we were very nervous that, maybe she would feel higher and fall down and hurt herself. But she felt nothing like that. And I asked her at the end of the first day, I'm like, how do you feel? And she had to just think and almost be like, look around and say, like, I don't have any pain. I'm in tears because I've never heard my mom say that. So it's one of the only things that's helped her, and the pure CBD oil has not made her loopy or more susceptible to falls. So that's been really, really, really helpful and worth it for my family. So anyone that's afraid to try it, I guess I would say look into your options. In the CBD oil, it's not the same traditional impact that people think of, like smoking marijuana.
Sure. So. Thank you so much for sharing that. We had a hand right here. And then I know I have some web comments that I want to get to.
Hi, my name is Bob. I have CMT1A, and I find that I don't really have a single treatment that solves everything. It's really a treatment program for me. I do take medications, Elavil and gabapentin, but at very low doses. That seems to work for me. Exercise helps with pain management. Physical therapy has worked for me. I even went to my physical therapist and said, hey, that bench really works well for me. I don't have to get on the floor to do planks and T's and Y's and those kinds of things. Can I measure that and build one at home? Sure. Went home in a few hours, built my own exercise bench, and I use it to this day. I use a treadmill. I have 2 different sets of handles on it so that I can both maintain my balance and switch my hand grips because my hands tire quickly and easily, but I still manage to get that exercise in. So it's a complete program, I guess, that the sum total which works for me. All sorts of adaptations around the house. I have a cane that I don't see very many people use, but it converts to a seat because standing in one place for very long, just standing in a grocery store line is really agony. I mean, most people don't want to stand in line because they're impatient. I don't want to stand in line because my legs tire out so quickly. So I have this with me wherever I go. If I'm in a wide open space where I can't reach out and touch something and I need to sit down or whatever, that's a great adaptation for me. So I have lots of those little things that I've learned over the years, touching the shower when you're washing your hair, all sorts of little things like that. But I've also found that being aware of other issues, health issues that I could have that are unrelated to CMT, it's important to differentiate those and then treat and deal with those because it really is a total body concept. Finding vitamin deficiencies and correcting those, finding hormonal deficiencies and correcting those, that it's all everything together that really sort of keeps me in the ball game, if you will.
Oh, that's great.
And last but not least, the hearing problem is just a mild nuisance to me, real problem for my wife.
Thank you. All right. Can we get Matt a mic? And then we'll work our way up here.
Right, we got a couple of additional comments from viewers. One viewer recommends alpha-lipoic acid, which is an over-the-counter supplement she's successfully used to relieve neuropathy pain. I hadn't heard much about over-the-counter supplements, so I thought I'd throw that in.
Thank you.
Another writes about plastic AFOs, saying that the plastic AFOs are not effective and are prone to break very easily. And unfortunately, insurance coverage lacks for cost of carbon fiber AFOs. So not only finding something that works, but something that's going to last is definitely a challenge. And on a personal note, and again, I have CMT1A, I want to build on Estella's comments, and follow-on comments about the importance of exercise, but take it a little different direction. As Lainey was talking about earlier, and the frustration and stress of being a patient and a caregiver, both patients and caregivers need to take time for themselves, whether it's exercise or mindfulness or whatever is going to help you help yourself. Don't forget to take care of yourself, because it's so easy to get swept up, dealing with the everyday frustrations or dealing with being a caregiver, but don't forget to take care of yourself.
And what is it that works best for you in that category?
For me, it's getting out on my bike. I've heard about cycling from the doctor earlier and others, but some time for myself, keep moving. That's what I really enjoy.
Great, thank you. All right, so we'll take the comment here.
My name is Crystal Gray. Our daughter Megan Gray has the TRPV4 gene mutation, which results in symptoms of CMT2C and SPSMA, exactly the same as Stephanie. And one thing that has come to my mind as we've had this discussion is the importance of finding your tribe, I guess you could say, in considering treatment options. We found a Facebook group that Stephanie started a year ago when my daughter was diagnosed. And I would have had no idea what to look for, as the many, many doctors we saw had never heard of this particular type. And so it was helpful in speaking to her just to find a neurologist who had actually seen her type. And it's been so helpful, and I appreciate Anna as well, who's come from Germany, who has the same type. In talking to them, because I am able to, as a mother, look for the symptoms much earlier than they were. We're able to treat the symptoms sooner, which I think will ultimately give her a better quality of life. And so that's my comment, is just finding your tribe, and in being here today and in all of you sharing your experiences, it's been so helpful to become more aware of things that are associated that I would not have been aware of otherwise. So thank you to all of you.
Well, thank you for sharing, Crystal. I do want to ask, so you found your tribe and you were able to get some maybe treatments or interventions earlier. Can you just share a little bit about what that is and what you're doing?
We noticed she's adopted from China. We adopted her at 20 months of age, and she had bilateral unrepaired club feet, and that was all that we knew about her medical condition. We noticed that she had some swallowing issues and would aspirate on thin liquids, and then we also noticed this noisy breathing. And when we brought it up with her pediatrician, they said, oh, it's called stridor, but we don't know anything, we don't know why. And we went through a variety of different tests trying to figure it out, but it wasn't until we connected to the TRPV4 community that we realized that the respiratory issues are intricately tied into the disorder. And so now we're able to closely monitor it every 2 to 3 months with an ENT and determine if she will need surgical procedures down the road or not. We see a pulmonologist regularly. She hasn't shown any sign of diaphragm weakness yet, but we're prepared for that. One other example is with the sensory neurohearing loss. I never, ever would have thought to have her tested for hearing. That was one thing we were grateful she seemed to be fine with. She's got glasses. We had her vision tested. But because we found out about it, we were able to closely monitor her hearing. Every 6 months, we see the audiologist. So we can hopefully catch some of those things early on and, again, provide better quality and better outcomes for her long term.
Sure. Thank you. We had a hand, 2 hands at this table. We'll start at the front and then work back.
Hi, I'm back again. First of all, I just dittoing pretty much a lot what everyone was saying, but the exercise using, I use an elliptical, I use yoga, I go on YouTube and I get some Tai Chi going on, and I mean, that YouTube is like an amazing thing. You put in how many minutes you want and you get it. But I was also using the Alter G. I just wish I had more coverage with insurance to use it, and I found that to be phenomenal because I was really able to see the progress. I didn't use my braces, but I had the support of the machine, and I wish I could afford to have that in my house because I was working the gait, which the braces cut off. So that was amazing. And the other thing is that to never give up on finding a doctor. They're out there that listen to you and work with you, and I've just recently found a few doctors that I'm like, I just broke down in tears because I'm working on a lot of different things with my body, and I felt like she finally heard me, and now I'm a variety. I mean, I have a medical doctor, I have a doctor, I have an osteopath, I'm working on a variety of things, and finally is diet. I'm doing, no flour, no sugar, the inflammation. I'm really listening to how my body reacts to different foods and really trying to understand what's working, what's not working. And, it's a total picture. And that's my deal.
Yeah. So Sherry, when you said you were able to work your whole gait, you were talking about being able to work out.
G.
Yep. What did you notice, since you said you haven't been able to necessarily keep doing that, what was the short-term benefit that you realized?
Oh, gosh. Well, I was able to, because you take away some of your weight, like you can, it had like, I don't know, 50%, whatever. I was able to use more of my weight and working on longer strides. And my goal was, wow, I can't believe that I can do this. And my next goal was like a dream. I was like, wow, maybe I could even work on building, what's the word I'm looking for? You know, like your jog, you know what I mean? Like to be able to, like, oh, could I maybe run one day? Oh my gosh, like this thing could help support me. I mean, that's like, but one day when I win $1 million, I'll get the machine and then I will get there. I mean,
Yes.
So that's my feeling.
Okay.
Okay.
Thanks. You can just pass it right on back.
Hi, I'm Lainey again. This is my daughter Zoe, who I want to talk about. And second, when I tell you that I do everything probably wrong, like I drink Diet Coke, I don't care what I eat. I mean, I eat healthy, but more for vanity than for CMT probably. So, but the one thing I have done, and I tell everybody all the time that the one thing that I've done that I feel like has slowed the progression is Pilates, and not just a mat Pilates, if you're familiar with Pilates. Unlike yoga, it doesn't require any balance, and you're always holding on to something. So it's something that after 20 years, I'm really good at, and a reformer machine moves, and it allows you to put your feet, and I have special straps that I bring to classes because my feet are fused, so it holds them in place. So I just, which I'll talk about in tomorrow's thing, but this has allowed me to do 5 things at once: cardio, stretch, keep my core strong, which is the only thing I think we can do, like right now, is to accommodate for all the nerve loss is your muscle strength. And my daughter Zoe here, who's 17, she didn't exercise a day in her life up until last year. She complained constantly about, her muscles hurting, being tight, and she couldn't even touch her toes. I mean, she's a little person, and there should be no reason, right, except for CMT. She couldn't touch her toes. She couldn't stretch. Zoe, I was joking. I was telling someone earlier, I pay her to go and do Pilates, like pay her money, bribe her. And she is now, not only can she touch her toes, she did the splits last night for me in the room. I mean, she's so strong, and that's what you have. And about the cost factor, okay, I'm not an insurance person, I don't know, but I'll tell you, Pilates is very expensive, but in where I live with Blue Cross, it covered, when you get my physical therapist, physical therapists can be Pilates teachers, and so I would have a doctor write a script, and then, when the physical therapy ends and you have that, month before you can then redo physical therapy again, I would barter services, like I thrift store shop and traded services. So there's things you can do if you want to make things work for you.
So that added strength, that added core strength, what did that translate to in daily life? Were you able to?
Well, again, everyone is different, okay? I can do stairs. I take the stairs. I don't avoid the stairs. It's hard. I mean, my feet don't have any movement, but I make a point of doing the stairs, use it or lose it. Mm-hmm. When you can, you should. And I have a website, which, I'm not trying to self-promote, but on there, a lot of these people write me and say, my doctor told me never to exercise, that I can make CMT worse. And I'm like, okay, please don't sue me, but please start exercising, because that's the only thing you can do. My mom, who passed away, yes, it was from respiratory issues, but it was also because she never exercised. She didn't have the strength around her diaphragm to help her to get past it. So when she got the flu, she was only 71. I mean, she was so susceptible because she was in a chair a lot, she was sitting, and she wasn't moving. I bought a standing desk. Do I like to sit more than I like to stand? Hell yeah. But I stand because that's the only way that I'm gonna keep standing. So that's it.
Yeah.
Oh, yeah,
Thank you,
say
Lena.
hi. Hello.
All right, so we got a hand up here in the front. And then while we're getting a mic over there, since we're getting towards the end of our time together, I want to make sure that anyone with thoughts about what, short of a cure for their disease, that they would look for specifically from a future therapy. And again, one way to think about this is when you think about all of the things that are most burdensome to you in your daily life, there's impacts that we talked about this morning, what amount of change or benefit on any of those symptoms or impacts would make a difference for you, would be meaningful? But feel free to go ahead and say what you're going to say, just throwing that out for people to soak in.
All right, thanks, James. I'm Carly Lutz. My son is Jacob Lutz. He was up on the panel this morning. And I did want to talk about acupuncture because someone mentioned that. And it's really dry needling is what Jacob receives. And he receives that once a week during physical therapy. And they were focusing before the dry needling on core strength, and we still do that. But we got cut off from physical therapy services because of our insurance, and that was in October of last year. So from October till December, Jacob wasn't getting any physical therapy, and we saw a drastic decline in his abilities. He was falling multiple times a day, going down the stairs, going up the stairs, just over a little ledge he would trip all the time. But we finally got our physical therapy services reinstated in January, and his physical therapist wanted to try dry needling on him. And at first he was terrified because the needles are like this long, and he's thinking that they're gonna go all the way into his muscles, and he's freaking out. But our physical therapist is amazing, and she said, just trust me, just trust me. And so he did, and she does it every week, and I tell you what, he went from falling multiple times a day to maybe 5 in a month. His balance is much better than it ever has been. Of course, he's still losing strength. You know, his grip strength seems to decrease every single month, but he's able to not fall as much, and he does seem to be stronger. So I would encourage you to look into dry needling because it has really helped him. So.
Thank you, Carly. Okay, can we go to Anna? I have a comment right here, and then we'll come to the back.
Hello, I'm Anna, CMT2C, and what helps me most is going swimming. If I go swimming twice a week, I don't have any pain in my back. And if I stop going swimming after a couple of weeks, I get headaches and pain in my back. And I've done it all my life, and I think that's just what's keeping me alive.
Wow, thank you very much. Okay. And in the very back.
Again, my name is Lelia. I have CMT1A. I'm not going to go into too much storytelling other than to say what's worked and what hasn't. And maybe have some after this conversations with people that have some input for me. Medicine-wise, fatigue, just in the past year, I started taking off-label phentermine, which is a diet drug, and unfortunately it has not helped me lose any weight because it really is just giving me the energy to get past that 3 p.m. hitting the wall. So it would be wonderful if it could be prescribed for that, not just off-label, so that my insurance would actually cover it, because it's made a huge difference in my life. As has physical therapy, and what they were just saying about your insurance covering it as much as you need it is so important for all insurances to get on board with that, because I see a huge difference when I don't get physical therapy or have activity. Specifically, as she mentioned, dry needling has made a huge difference. And I'm not sure what the correct medical term for it is, but it's pelvic floor physical therapy, which can be a weird topic, but it has made a huge difference in my strength in my core, bladder control, I think breathing as well somewhat. So for people that are having a lot of issues with that, that may be something you want to seek out. And adaptive sports. If you have a program, young folks that really want to be doing the things they don't think they can do, there's adaptive sports programs all over the country, and you know, when I was in public school, like I mentioned earlier, the ADA was just coming into place when I graduated. And I didn't have access to any of those things. So it's made a really positive difference, not just physically, but now that I'm on a team and participating and seen as one of the group, it's been very encouraging. And then I just had a couple of questions medical-wise, and if anybody can give me some answer afterward, I would appreciate it. I've heard about prolotherapy to help regrow ligament tissue. For instance, my hips are basically blown out because my muscles stopped holding my hips together a long time ago. And I'm just curious if anyone has any knowledge, because it's injections and the way that it's given, if there's any knowledge to whether it could hurt or help someone that already has myelin breakdown. And then anyone that's had a Harrington fusion for scoliosis. I had severe scoliosis, and I think I was in the last little age group of people to have Harrington fusions, which were not really corrective. They just smush you straight and fuse your lumbar area, which has caused a lot of problems with flat back syndrome for people. So I'm just curious if anyone has any information on dealing with the issues associated with that, and if anyone's had corrective surgery to fix the first surgery.
Sure.
And that's it. Thank you.
Thank you for sharing. Okay, so we have time for a few more comments. I'm going to take Matt with the web comments, and then we'll come right back here. Again, we're still covering current therapies and approaches. If anyone has any thoughts about what they would look for from a future therapy, I would love to hear that. Matt?
So just some additional input from some of our online viewers. For those looking for alternatives for exercise that are dealing with balance issues, we've got one CMT patient who's a big fan of rowing machines, a Concept 2 rowing machine, saying you don't need to have any balance, and he's put in over 2.5 million miles in the past 2.5 years, so obviously it's working for him. Had a number of viewers chime in on some of the insurance issues that are related to some of the physical therapy and bracing. So a lot of people in support of trying to get some change happening there. And a lot of good input, follow-up on cannabis, and two different people chiming in saying that they have issues because they work for companies that have federal contracts, and there's all sorts of complications that come with that. So good input.
Sure. Thank you. Comment in the back.
Yes. Okay. So to go off what the lady was saying over here about the multiple surgeries, I think she was asking. I had 2 surgeries on my hand, and at the time, both of them worked extremely well. And during the physical therapy afterwards, it worked extremely well. And then once this physical therapy stopped, it pretty much was worthless. So surgery and physical therapy, as everyone's been noting, works very well. It's just not infinite. And the other thing that I've tried, I just got some carbon fiber AFOs as opposed to the plastic ones, and they are a lot better, especially with the chafing and the moleskin and all the bandages. I don't need to do all that with the carbon fiber ones. And then I believe you asked what would people like to see in terms of like long-term or like upcoming treatments.
Yes.
And I would like to see either treatments that incorporate better into your daily life routine. Like, I can't do physical therapy exercises on my own half the time. If there were exercises that I could do at a gym or like just a better exercise routine that I could carry on without the supervision of a physical therapist, that'd be great. And for drugs, if it was a finite amount of time that you had to take the drug, because I personally don't want to be on drugs for the rest of my life. And that's what I would like to see in terms of a drug application.
Mm-hmm. Sure. Thank you. So we have 2 hands. Do we have any other hands? All right, these will be our last 2 comments.
Thank you. This is more of a question for the group, for someone to approach me afterwards. I'd like to hear your stories or opinions on how you've dealt with disability insurance companies. I worked at a very, very high level for 35 years and was totally unprepared for the financial disincentives and how difficult it was to work with that particular issue, because I love to work and would want to continue working, but dealing with the differences in pay and those kinds of things and the restrictions, it really seemed to be more aimed at dealing with people who are fraudulent versus folks who really need the program. And so anybody who could share anything with me on that, I'd love to talk with you after the session today. Thank you.
Thank you. And our final comment.
Hi, everybody. My name is Bernadette. Some of you, or most of you, may know me from the documentary called Bernadette that came out in 2013. I've been working with H&F for 5 years now, and I'm thrilled to be here with everybody. I just wanted to say that. And I wanted you guys to know that for the last year and a half, almost 2 years now, it was sponsorship came to me. And I have an indoor therapy pool, and it's probably the best thing that's ever happened to me in my entire life. Not only did I quit smoking cigarettes, but I am walking in the water, eating better. My energy level is up. I mean, it's just, I want everybody to know that being in the water has definitely saved my life. I mean, I just want to encourage anybody that can either go to physical therapy, find a therapist that has aqua therapy, or if you're interested in learning more about having your own indoor thermopool, you can come to me, and obviously I can talk to you about that. But being in water, the hydrostatic therapy and pressure is so good for us. Even just being in water and just sitting in water is healing for anybody. So I highly, highly recommend anybody getting in warm water, especially for circulation and pain.
Thank you, Bernadette. So that concludes the time that we have for our discussion on perspectives on treatment. Of course, these same topics have been coming up throughout the whole day, as you've described, hand in glove, the different burdens that you've experienced along with the treatment approaches that you've had. So I think this was a nice opportunity to explore some of the additional methods of treatment beyond some of the more common ones that came up throughout the entire day.